So we made all of those changes so that he could be happier. Bronchitis is gone. He even developed terrible skin rashes. All of those all cleared up. And as all of that's happened, he's become more vigorous. He's even talking about getting in shape, which he hasn't done for over 40 years. Hello everybody, I'm Dr. Dean Howell. We're talking about clinical outcomes with our parasites, yeast, and fungus program. This time we're going to talk about Bob. Now, Bob has been a friend of ours for years, and he was morbidly obese for many years. We're talking about a 60-inch waist, big guy. And not only was he really fat and having a lot of oiliness and greasiness on his skin, but he was also tired all the time, and he kept getting colds and bronchitis. So maybe every 6 or 8 weeks, he would have another cold, blowing his nose, coughing stuff up. And when his breathing became a problem, he would have to use the asthmatic inhalers. One of the practitioners he saw said, "You have viral bronchitis." Well, that doesn't even exist. But the point was that he was not doing well. In fact, over the last 25 or 30 years, he had slowly gotten worse and worse. So we confronted him on this and said, "Are you tired of this yet?" And he says, "I'm already taking everything that can kill all of these things, and I'm already supporting my immune function." We want you to understand that if you're having frequent colds and flus, it's not a lack of echinacea or golden seal or needing more zinc, because those are all short-term remedies. What we wanted Bob to do, and what we want all of you to do as well, is that we want to start treating underlying causes. So what we wanted Bob to do was to stop eating carbohydrates, meat, fish, birds, cheese, maybe a little cream, no carbohydrates at all. And then we wanted to start putting him on supplement programs to kill parasites and yeast. And then after that, wait a few weeks and then do it again, and wait a few weeks and do it again. Keep doing these 10-day parasite programs so we can get the number of bugs living inside to go less and less. And as that happened, what we expect is that people will get better. So sure enough, as we did supervise this with Bob, at first we did mild treatments, and then we gradually increased the intensity and got to a point where he couldn't even go to work for a few days. But as he did that, besides losing over 150 pounds in a year, was that he started feeling mentally sharper, he started having energy, he started enjoying doing more things, he started making plans for his life, whereas before he was just getting through and getting by each day, and when someone asked him what he was going to do next month, he usually didn't know. Well, now he plans ahead. Now he's making plans as to what he'll do for the rest of his life. What it was all revolving around was killing off the parasites, yeast, fungus. He wasn't catching a new disease every 6 weeks. He had the same illness coming up because he would eat worse, and then they would activate. Then he would feel really sick, and he would clean up his act for a while, get over that terrible time, go back to eating more junky, and then get sick again. So we made all of those changes so that he could be happier. Bronchitis is gone. He even developed terrible skin rashes. All of those all cleared up. And as all of that's happened, he's become more vigorous. He's even talking about getting in shape, which he hasn't done for over 40 years. So some wonderful things that can occur. You just need to follow through. Let us help you with those programs.